What about the slides?
We will be sharing, sir. Or you are ready to share, or we will be share, sir. We will be sharing, sir.
You can share now.
Yes, sir. Yes, sir. We will be sharing, sir.
Okay. Into our meeting on it. Zoom class on into our
Shall we start the session, sir?
Yes, we will start.
Okay, sir. Okay. Every sunset brings the promise of a new dawn. Get your thoughts calm down, get all blossom. Good evening, everyone. With great joy and immense exaltation, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. Sudhir Raj N. Memorial Webinar Series organized by DIKSHA E-Learning Asadika Amrit Mahotsav in association with Ayurveda College, Coimbatore. In today's session, we will be discussing about Ayurvedic management of Ardhavabedhaka by Dr. Satish Shanker. Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbances-free session. In case of any disruption, please check your internet connection first, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised, posted in the chat box. Question rates will be cleared at the end of the session. Next, I would like to invite Dr. Jeeva Ma'am, Assistant Professor, Department of Shalikatandra, Ayurveda College, Coimbatore, to deliver the welcome address. Jeeva ma'am? Am I audible, ma'am?
Thank you, Donna. Good evening, one and all. On behalf of Ayurveda College, Coimbatore and DIKSHA E-Learning, it gives me immense pleasure to extend a very warm welcome to our guest speaker. As you all know, we have Dr. Satish Shanker sir to detail into the concept of Ayurvedic management of Ardhavabedhaka, migraine. I extend a warm word of welcome to our guest speaker for accepting our invitation and for being with us here today. Hope this discussion will be one among the best to look into our concept in a new perspective. Let me proudly welcome all the delegates who have joined with us today. Welcome you all once again. Thank you. Thank you, one and all.
Thank you, ma'am. It's a great pleasure for me to introduce our guest speaker, Dr. Satish Shanker, Professor, Department of Shalikatandra, Bapuji Ayurvedic Medical College, Challakere, Karnataka, India. Sir completed his BAMS from SDM College of Ayurveda, Udupi, and MS Chalikatandra from Government Ayurvedic College, Bangalore. Sir worked as professor at Alvas Ayurvedic College, Mudabatri for 5 years, and since 6 years is currently working at Bapuji Ayurvedic College, Challakere. Sir has published a book on practical handbook of Panchakarma procedures. We are very proud to have you here on this session today, sir. Now, without any further ado, we will turn the time over to Dr. Satish Shanker, sir, to enlighten our minds with his knowledge. Over to you, sir.
Okay, thank you. Good evening to all. So today we will discuss about the Ayurvedic management of Ardhavabedhaka. And before starting the Ardhavabedhaka, we will start from the headache. As an introduction to the headache, can you share the slide introduction?
Yes, sir.
Is
Sure,
it
sir.
is it audible?
Yes, sir. Audible, sir.
Please share the slide. First slide.
Okay, sir. 1 minute, sir.
So Shiras is the one of the Uttamangam, as you know. And coming to the headache, definition of headache. Headache is nothing but the pain in the head is called as a headache. So headache is one of the most common presentation in clinical practice, and it is sometimes produces the headache for the physician also, even though it is a simple presentation and sometimes very difficult to diagnose the exact cause of the headache. So first coming to the classification of headache. So classification of headache, clinically it is very important to classify the headache. But it is theoretically it is classified into a primary headache and secondary headache. So when the headache is presenting as a disease and it is a main symptom and it is also main disease, then it is called as a primary headache. In the secondary headache, headache is only a symptomatic presentation there of another disease. It is a symptom of another disease, then it is called as a secondary headache. Primary headache means headache is the primary disease there. So primary headache includes the migraine headache, cluster headache, tension headache. This comes under the primary headache, where the headache itself is a disease there. But secondary headache is the one which is where headache is only a symptom there. It is a presentation of another disease. So it is called as a secondary headache. Primary headache and secondary headache. Secondary headache, example is sinusitis, where the inflammation of the sinus, it may be a maxillary sinusitis, frontal sinusitis, or sphenoid sinusitis, ethmoidal sinusitis. These sinusitis can also present with the headache. And a simple flu fever can also present with the headache. So these are the symptoms in the another disease. So just headache is a symptom there. Presentation is presenting in from another disease. So such a symptom is called as secondary headache, where there is a symptom there, not a disease. So this comes under the secondary headache. So this is a theoretical classification, primary headache and secondary headache. But very important is practically headache should be headache is classified as an emergency and non-emergency headache. So this is to take a decision, because headache is a simple presentation, but sometimes it may be a fatal disease, fatal presentation, headache. So we should be very careful while handling a headache patient. So we should rule out first emergency headaches. Therefore, it is very important clinically when a patient comes to us in headache as a presentation or a main symptom, then we should be very careful that it is not an emergency headache. Emergency headache is a headache which can be fatal to the, it can be fatal. Therefore, we should be very careful while patient comes with an headache. So emergency headache and non-emergency headaches. So emergency headaches are subarachnoid hemorrhage is one of the emergency headache, and another one is the meningitis. So how to conclude whether it is an subarachnoid hemorrhage or meningitis? Meningitis usually presents with severe headache, and then it will be presenting with the fever. But very important is that severity is not a criteria in clinical practice. We cannot say that because of the some patient even mild headache they will present as a severe headache, and some patient with severe headache also they will present as a mild headache. Therefore, severity we will never consider it for the diagnosis or come to the conclusion, because severity is by the patient's words. So in Ayurveda also there is a concept of Guru Vyadita and Lagu Vyadita. So even though some patients are presenting with a mild headache, they will present as a very severe headache. And some patients of very severe headache, they will present as a mild headache, depending upon the strength of the patient. Therefore, severity is never criteria in clinical practice for the conclusion. Therefore, we should not come to a conclusion by patient's words of severity. Therefore, in meningitis, signs are very important than the symptoms always for in clinical practice. So it should be when the patient presents with a headache, fever, and it can be a flu fever also. But how to conclude whether it is a meningitis or other fever? So here it is meningitis, headache is there, fever is there, and then signs are very important. In meningitis, increased intracranial pressure symptoms will be there. Therefore, these should be history taking and examine signs for the intracranial pressure increase symptoms and signs. These are very important to diagnose the meningitis. And when we have a doubt about the meningitis, you can also go for a scan, CT scan, or you can also go for a lumbar puncture to come to an exact diagnosis. So whenever we have a doubt, we can go for a CT scan or lumbar puncture in the meningitis case. And subarachnoid hemorrhage, history taking is very important. Subarachnoid hemorrhage, usually there will be a history of the injury. History of injury will be there, head injury will be there, or a history of injury is very important. So a very young patient comes with severe headache, we can ask for the history of about the injury. So whenever injury is there, you can severe headache is there, then there may be chance of the subarachnoid hemorrhage. Then you can go for the again CT scan or MRI of the brain. So this is very important to rule out the emergency headaches. And in subarachnoid hemorrhage also, increased intracranial pressure symptoms and signs are very important for the diagnosing the subarachnoid hemorrhage. So coming to the non-emergency headaches, all other headaches will be comes under the non-emergency headaches. So this is very important for the clinical. We should not miss an emergency headache there. Therefore, practically this is very important classification: emergency headache and non-emergency headache. Because headache patient whenever comes, we should rule out first about it is a non-emergency headache. So emergency headache should not be missed, because if you miss the emergency headache, it is going to, it will be a fatal headache. So that this is first of all, this is very important to in the diagnosis of a simple patient comes with a simple headache. So all other headaches comes under non-emergency headaches. It may be a periodic headache or non-periodic headache. These all comes with the non-emergency headaches. A glaucoma can also present with an headache. A sinusitis can also present with an headache. A migraine is also present with an headache. Cluster headache is also present with an headache. All these headaches are not fatal. It is not going to result in a death of the patient. Therefore, they are comes under the non-emergency headaches. Yes, next slide, please. So coming to the today's topic, that is the Ardhavabedhaka. So it can be correlated to the migraine headache. So first I will consider about this definition of migraine. So when it is called as a migraine, so three criteria is there: half-sided headache, pulsatile headache, and periodic headache. Then only it is considered as a migraine. So whenever half-sided headache is there, present is there only one criteria is there, then it is not a migraine headache. So half-sided headache is not a simple criteria. So along with that, it should be a pulsatile headache and it should be a periodic headache. That is the most important triad of migraine. That is, it should be a pulsatile headache, half-sided headache, and it should be an periodic headache. So these three are very important criteria for the migraine. Therefore, the definition of migraine is it is an half-sided, pulsatile, periodic headache. So then it is called as a migraine. Yes, next slide. Coming to the causes of migraine and pathology of migraine, usually it is most common in the familial. If one person is having, in your family is having, a father or mother is suffering from migraine, it is children usually they will also get the migraine. So it is familial. One of the possibilities, it is a familial. And it is most common in teenage people. It will start the migraine in the teenage. And it is most common in the female. female patients are usually, female are more having chances of getting migraine because of the hormonal changes. Why female are most prevalent to migraine than male? Because of the hormonal changes in the female that can cause the result in more cases of female than male. So this is one of the possibilities. So another very important pathology of migraine is, it is a CNS disorder. Migraine is a CNS, central nervous system disorder, and it is considered as a neurovascular disease. Neurovascular disease. Migraine is a neurovascular disease. That is, it is considered as an hyper-excitable brain. Hyper-excitability of the brain is responsible for the migraine. Due to this hyper-excitability of the brain, it leads to the abnormal nerve signals. Abnormal nerve signals leads to the vasodilatation of the cerebral arteries, and these cerebral arteries vasodilation results in severe. Whenever there is a vasodilation, it results in the pain. So it is a pulsatile headache there because of this vasodilation. So that is the how the pathology goes in migraine. And coming to the triggers of the migraine. So there are many triggers for the migraine. So one is the bright light. Whenever the patient exposes to the bright light, patient complains of severe headache. This is because of the sensory overload. Sensory overload leads to the, again, brain excitability. Brain excitability leads to the, again, it leads to the vasodilatation. So vasodilation because of the brain excitability, again, CNS, central nervous system. Whenever sensory overload is there, some chemical changes, they are called as a neurotransmitters are released. Whenever these neurotransmitters are released, they trigger the migraine headache. So this is one of the reason, that is a bright light is considered as a triggerer for the migraine. Another one is a large sound. They are sound sensitive. Migraine people are sound sensitive. Whenever they hear a large sound, it will lead to the, again, same thing, sensory overload resulting in the migraine trigger. So another one is the perfumes or scents. If there is a perfume is there or scent is there, that can also lead to the sensory overload. Again, these are called as a migraine triggerers. Skipping meals. If you skip a meal, that is also a trigger for migraine. Or food. Coming to the next, food. Cheese, salty food, and artificial sweetener. Whichever food which contains the artificial sweetener, they are considered as triggers for the migraine. And chocolates, these are also considered as a trigger for the migraine. These are comes under in the food which will lead to the trigger for the migraine. Next, coming to the hormonal changes usually seen in the female during the menstrual cycle or during any hormonal changes, that leads to the trigger for migraine. Another one is a physical strain. Excessive physical strain can also lead to the migraine. And sleep pattern, there is a loss of sleep or excess sleep can disturb this. Any sleep disturbance is there or excess sleep is there, that can lead to the triggering factor for migraine. It may be a trigger factor for migraine. And very important trigger for migraine is anxiety, stress, and tension. So this is a very important. Stress is the trigger, anxiety is a triggering factor, and attention is a triggering factor. So this is vice versa. Whenever those patients, because of the headache, again they will get anxiety, again it will increase the tension, and it is again going to lead into stress because of the severity of the migraine headache. So again it is going to increase the migraine. So it is both are mutually related. So these migraine triggers leads to the tension, anxiety, and stress triggers the migraine. And due to the migraine, again there will be anxiety because of the migraine headache, because it is a severe form of headache. Again, that goes to leads to the anxiety, stress, and tension. So again, this is going to result in trigger. It will trigger again another attack of migraine. So in migraine patients, in treatment, it is very important to handle the anxiety, stress, and tension. So if you handle these three triggers of the migraine, then it is very easy to handle the case of a migraine. Therefore, why triggers of the migraine is very important in migraine, because these triggers are the cause. If you handle these triggers, then it is very easy to handle the migraine in the treatment aspects. Therefore, it is very easy, very important to know the triggers of the migraine, so that we can advise the patient to avoid these. And some of these patient cannot avoid, and we should treat the patient so that the patient will relieve the headache. We can relieve the headache of the patient. So this is very important, triggers of the migraine. Yes, next slide. So migraine, types of the migraine is very important. So migraine usually presents with the two forms of migraine is there. Very important for the diagnosis or diagnosing a case of the migraine. So migraine presents with the two forms, that is migraine with aura and migraine without aura. So migraine with the aura patients usually start with the aura symptoms will start initially, and 1 hour after the aura symptoms, then it is going, they will start the headache. Therefore, before starting a headache, aura symptoms will be there. What do you mean by aura? So aura is nothing but it is a chemical or a wave, chemical or electrical wave passing in the brain is called as an aura. That is responsible for the aura. So aura is because of a chemical or electrical wave in the brain stem. So depending upon the area involved, it will present with the different symptoms. So for example, if the chemical wave or electrical wave passes in the brain, in the visual cortex, then the patient will have a visual hallucinations. So patient who comes with an visual hallucination means there will be difficulty in seeing the objects for maximum 1 hour. So very important here is how to differentiate between a patient, because some of the patient of the migraine comes with a visual symptom. That patient says, I am having a difficulty to see the objects. But how to we have to conclude the involved pathologies from the involved pathologies migraine here, because in migraine the visual problem or the patients having the difficulty to see the objects, or which is called a visual blackouts, or it may be having a problem in seeing the objects, it is not more than 1 hour in migraine. So if the patient comes with a visual problem for more than 1 hour, it is never a migraine. So migraine patients can only present with a visual problem is for maximum 1 hour. So this is very important to differentiate the visual problem is due to eye pathology and the pathology of due to migraine. So if the patient is having the visual disturbances or visual blackouts or visual hallucination or flash of light, these are the different presentations in case of aura of symptoms of the eye. So these are the presentations. So these presentations are how to confirm whether these presentations are due to pathology other than the eye. Very important clinically to differentiate between eye pathology and pathology due visual problem due to the migraine. If it is migraine, these visual problems are not more than 1 hour. So if it is more than 1 hour, it is not due to migraine, then patient may be having a problem in the eye itself. So this is how we have to differentiate aura symptoms of the presentation of the eye is due to a eye pathology or it is due to migraine. So this is one of the presentation of the symptoms of the aura. Another symptom is that patient is having difficulty to hear. So this is also not more than 1 hour. So there is a problem, something in the ear, that is some disturbances in the ear. So that is not more than for 1 hour. And another symptom is that patient may be having a difficulty to speech difficulties. This is also for not more than 1 hour in migraine. These aura symptoms not more than 1 hour. And another presentation is called as hemiplegic migraine. This is also an aura symptom. where the patient presents with the symptoms of half-sided weakness. So here also very important how to differentiate a stroke patient and hemiplegic migraine patient. Hemiplegic migraine means this is a symptom of the aura in migraine, where the patient presents with the half-sided weakness, and very important in history taking, this half-sided weakness is not more than 1 hour. Patient will recover completely from this half-sided weakness after 1 hour. So if a patient recovers from half-sided weakness after 1 hour, and patient is also having other symptoms of migraine, then it is confirmatory that this symptom is due to migraine. Stroke patient may be present with half-sided weakness, but it is not less than 1 hour. It will be a half-sided weakness patient will present. So that is how we have to differentiate a hemiplegic migraine from real hemiplegia. So that is the another presentation in aura. And a patient may also present with weakness in the muscles of the face. That is also another presentation of the aura. So these are the different presentations in the aura, migraine with the aura. So these all symptoms, not in a single patient. Some patient may have a visual disturbance, some patient may have a half-sided weakness, some patient may present with a like that. So not all the symptoms of aura are present in a single patient. So this is about the migraine with the aura. So aura symptoms very important clinically, not more than 1 hour in migraine. These symptoms will not progress more than 1 hour. So that is very important. Here to differential diagnosis. In differential diagnosis, this is the most important thing. To consider this as an aura symptom, not the other diseases. So that is migraine with the aura. So these symptoms will occur 1 hour. Then after 1 hour, they will start the severe headache. And very important, duration of the headache is very important in diagnosing the migraine. So migraine headaches, duration of the headache is 3 hours to 72 hours. That is 3 hours to 3 days is the headache persist in migraine. Some patient may, minimum is 3 hours, and some patient may maximum up to 72 hours, means 3 days. So it can extend up to 3 days, this headache. And it will be a unilateral headache, it will be a pulsatile headache, and it will be a periodic headache. Periodic means it will be every 15 days or every week, or some patient may every month they will be getting. So that is a periodic headache refers here. So another presentation is migraine without aura. Without aura means aura symptoms are not there. Classical aura symptoms is not there, but patient is having half-sided headache, pulsatile headache is there, and periodic headache is there. Then you can consider this is a presentation of migraine without aura. And time duration of the headache is very important in differential diagnosis. And site of the headache is also very important. To differential diagnosis, site of the headache is also very important. So site of the headache is half-sided headache, migraine. Cluster headache presents with a in and around the eyes. Headache will be more in and around the eyes. Headache is more cluster headache. If headache is back-sided headache, hypertension. Hypertension headache causes the headache in the back of the head. And patient comes with a headache in the temporomandibular joint. In the temporomandibular joint arthritis. Patient comes to a headache in the temporal region, temporal arteritis. It is an inflammation of the temporal artery resulting in headache. How to differentiate it from the other headache? Temporal arteritis patient usually presents as a patient cannot comb his hair. While combing the hair, he will get severe headache. Then it is confirmatory that patient is having temporal arteritis. It is an inflammation of the temporal artery resulting in the temporal arteritis. So site of the headache is temporal region, temporal arteritis. So site of the headache, temporomandibular joint arthritis can also result in headache. So site of the headache in and around eyes, it is cluster headache. So half-sided headache, migraine headache, back of the head, hypertension. So this is some of the very important in differential diagnosis of the headache by site of the headache. So migraine headache, site of the headache is important. time duration of the headache is very important. Time duration of the headache is 3 hours to 3 days in case of migraine. And it is in cluster headache, time duration of the headache is, it will be occur in clusters. Cluster means every day he will get pain for he or she. It will be for 2 hours every day, and it will extend up to 7 days or a month. Time duration of the headache is clusters will occur up to 7 days or a month. And then again, there is a relapsing period. No headache for some months or a year. Even up to 1 year, there is no headache. Again, bouts of headache, cluster headache. It will be for every day 2 hours. Severe headache will be there. Again, it will continue for 7 days or up to a month. Then such a headache is called as cluster headache. So time duration of the headache is very important in differential diagnosis of migraine and cluster headache. And another headache is there, trigeminal neuralgia. Trigeminal neuralgia is an inflammation of the trigeminal nerves can cause the trigeminal neuralgia. So how to differentiate it from migraine and other headaches? Trigeminal neuralgia patient will present with the shooting type of pain only for a few seconds during yawning, during chewing, or brushing the teeth can result in a shooting type of pain. Very important, the time duration of the headache is only for a few seconds in case of trigeminal neuralgia. So that is the time duration is very important to diagnose the migraine. So migraine headache usually occurs up to 3 hours to 3 days. So these are the symptoms of migraine headache. And it is a half-sided headache, pulsatile headache, periodic headache, and it can also present with the nausea and vomiting. And sometimes patient presents with after vomiting, the headache will relieve. So such a type of presentation is seen in case of migraine. So this is about the symptoms of the migraine. So next slide. Coming to the Ayurvedic concepts of so this is about the Is it audible?
Yes, sir. Yes, sir.
Okay. So if you consider the doshas mentioned by different authors here, Brihatrais, Charaka has mentioned that it is maybe Vata and Vata Kaphaja. 2 types of possibility. It may be Kevala Vatajam or it may be Vata Kaphaja. According to Vagbhata, it is Kevala Vataja. Ardhavabedhaka is Kevala Vataja according to Ashtanga, Hridaya and Ashtanga Sangraha. Coming to the Sushrutas concept, Sushruta has included Tridoshaja. Ardhavabedhaka is due to Tridoshas. So Ardhavabedhaka, Ardhabedam, Yasya, Tritayad. So Sushruta mentioned it is a Tridoshaja. And Sambeda Toda, Brahmashula Jushtam. And Brahma is included by Sushruta there. So giddiness or dizziness is included by Sushruta in the symptoms of the Ardhavabedhaka. So very important in the migraine with the aura patients can present with Brahma, or that is already we have seen dizziness or giddiness is one of the presentation in case of migraine with the aura. So Sushruta has considered involvement of Pitta also in Ardhavabedhaka. So Sushruta's concept is it is a Tridoshaja, and Brahma is also mentioned by Sushruta. And all the 3 authors have mentioned it is a periodic headache, Pakshat, Dasha, Tatavapya, Akasmat. It may be occur in every 15 days. It may occur in every week, or it may be occur in every month. So this is mentioned by all the Brihatrayas. It is a periodic headache. And coming to the another mentioned, it is half-sided headache. Ardhavabedhaka mentioned by Sushruta. And Charaka also mentioned it is Manya, Bru, Shanka, Karana, Akshi, Ardham. So Ardhavabedhaka means it includes the half side of the Manya, Bru, Shanka, Karana, Akshi, Lalata, Ardhe Ativedanam. So half side of the head is included by all the three Brihatrayas. It is a half-sided headache and it is a periodic headache. So this is mentioned by all the three Brihatrayas. That is Sushruta, Charaka and Vagbhata, both three, all of the three have mentioned that it is a half-sided periodic headache. And complication they have mentioned Ativruddho, Nayanam, Shravanam, Va Vinashet. Very important. Migraine with aura, we have seen that there may be visual disturbances and there may be disturbance too in the hearing. So Ativruddho, Nayanam, Shravanam, Va Vinashet. So this may be considered as an aura symptom which is mentioned in the migraine. So that is mentioned as a complication. So that we have exactly what we have seen in the aura symptoms. And coming to the Nidana aspect, Charaka has mentioned the Nidanas for the Ardhavabedhaka, where he mentioned that Rukshati Adyashanam. And if you see the Nidanas of Charaka, it is all Vatakara Ahara Viharas. So Charaka mentioned that it may be Kevala Vatajam or it may be Vata Kafajam. Or main Nidanas included for Ardhavabedhaka is it is Ruksha Ahara Atyashana Adyashana Puro Vata Avashyaya Maitunehi. And he has also mentioned that Ayasa Vyayamaihi, Ati Vyayama Ati Ayasa can also lead to the Ardhavabedhakam. So this is exactly what we have seen. Sensitivity to light is there, sensitivity to sound is there. That is exactly mentioned by Charaka also here as a Nidana, and we have seen as a triggering factor. These are seen as a triggering factor for the physical strain. Ati Vyayama we have seen as a trigger for the migraine. So that is exactly mentioned by Charaka here as Ati Vyayama can also lead to the Ardhavabedhaka. So what is very important here is, according to Charaka, it is Vataja and Vatakafaja. According to Sushruta, it is a Tridoshaja Vyadi, and according to Vagbhata, it is a Kevala Vataja. But all the three have agreed that it is mainly, main dosha involved is Vata in Ardhavabedhaka. So main dosha involvement in Ardhavabedhaka is Vataja. Therefore, in the treatment aspect, it should be kept in mind that main dosha involved in Ardhavabedhaka is Vata dosha. Therefore, whenever we are selecting a treatment, mainly focused on Vatahara Chikitsa Sutra. So this is about the different types of different authors mentioning about the disease of Ardhavabedhaka. Yes, next slide. Coming to the differential diagnosis, already we have seen very important in clinical aspects to differentiate that is a differential diagnosis. And headache, whenever a patient comes with a half-sided headache, and nowadays it is very important that tumor cases are increasing. There is an increase in cancer patients. Brain tumor can also present with a headache, which is similar to the migraine. Sometimes the presentation of the brain tumor is similar to migraine. And the most difficult part in the clinical practice is that when a pediatric patient below 12 years of patient comes with a headache, which is not responding to the treatment, then we should consider there are two possibilities. Half-sided headache is there, and presentation is same as that of migraine, but sometimes vomiting is there, severe vomiting is there. So then there is a cranial pathology leading to
Sir, you are not audible, sir.
Is it audible?
Yes, sir. You are audible, sir.
So in pediatric patient, it is usually not a CT scan is not advisable. So you should avoid the CT scan in pediatric patients because it is not good for the radiation. Exposure to radiation is not good for the pediatric patient. Therefore, very difficult sometimes to differentiate between a brain tumor from migraine because sometimes the presentation is same. Depending upon the site of the tumor, brain tumor, it will have different set of the symptoms. Therefore, we should be very careful while come to a conclusion of a migraine in case of a teenage patient. Because many patients we have seen in the clinical practice that brain tumor is missed. And in the later stages only, they are diagnosed as a brain tumor. And initially, they have diagnosed it as a migraine. But it is usually not a migraine. But finally, it is concluded as a brain tumor. So many patients, such a scenario is there. Therefore, a brain tumor should not be missed in the clinical practice. So because the difficulty here is that we cannot directly advise the child for a CT scan because the radiation exposure is not good for a pediatric patient. Whenever we have a major doubt that it may be a brain tumor, then only we can suggest a CT scan for a teenage patient. So therefore, it is a difficult sometimes because it depends upon the site of the tumor. It can have presentations. Sometimes brain tumor can present with a, but how to usually differentiate between brain tumor and migraine is that brain tumor usually wakes up the patient in the night time. Such a severe pain will be there. And associated symptom is very important in brain tumor. It may be associated with a weakness of the numbness, weakness of the half side of the body, or numbness is there. Then you can directly go for to confirm the diagnosis, we can go for CT scan. So another symptom is there, whenever tumor is there, it can result into increased intracranial pressure symptoms, vomiting is there, nausea is there. But that symptoms are also seen in the migraine. So that is, we cannot differentiate whether it is a migraine or whether it is a tumor there. So then it is we have to see the other symptoms of the migraine, pulsatile headache, periodic headache. So this periodic headache is very important to differentiate between a brain tumor and time duration of the headache is also very important. Time duration of the headache is not more than 3 days in case of a migraine, but brain tumor, it can present for a week or 10 days or continuous pain may be there. So that is how we have to differentiate it from a brain tumor and migraine. So even though we can differentiate, sometimes it is very difficult practically, sometimes it is difficult to come to a conclusion. So we may require a CT scan to differentiate between to come to a conclusion, to rule out a tumor in the brain. So this is one of the very important thing which should not be neglected in the clinical practice. And another differential diagnosis for migraine is cluster headache. Already we have seen, and that is time duration is important to differentiate between the cluster headache. Cluster headache is also present with some of the other features of rhinitis. It can also present with conjunctivitis. It can also associated with the ptosis. So ptosis is nothing but a drooping of the eyelid. So these are the associated symptoms seen in the cluster headache, not in migraine headache. These symptoms are not seen in the migraine headache. These are seen in the cluster headache. And site of the headache is very important in the cluster headache. Cluster headache is maybe a half-sided headache, but it is usually in and around the eyes. Pain will be more, not the entire half side of the head. It is usually concentrated on the eye. In and around the eye, headache is more. Site of the eye is very important. Site of the headache is very important to come to a conclusion. And the duration of the headache is also very important to come to a conclusion, to differentiate it from a cluster headache. Coming to the another headache, tension headache. Tension headache is also how to differentiate. So tension headache usually bilateral, not unilateral. Tension headache is usually bilateral, and it is usually a dull headache. Dull headache means heaviness of the head is the main presentation there, tension headache. Or patient present is a band which is tied to a head, like that patient will present. It is not a severe form of headache, it is only a dull headache or heaviness of the head. So that is very important, and is usually for weeks. This will be present, not more, it will be more than 3 days, and it will be usually for 1 week. It will be there, tension headache. So other form of headache, sinusitis. When the inward sinus is only one side of the sinus is inward, it can present with an half-sided headache, but it is very typical. You can examine. Tenderness will be is there in the inward sinus. If frontal sinus is there, sinusitis is there. A typical presentation in the frontal sinusitis, it is starts in the early morning, goes on increasing, and evening time it is going to subside. Such a typical presentation is there in frontal sinusitis, and there will be a tenderness in the frontal sinus area. And if you go for an X-ray, you can conclude that there is a haziness in the frontal sinus area. So then you can confirm that it is a frontal sinusitis, and severity is also you can come to a conclusion by getting an X-ray of the PNS, paranasal sinus X-ray will show you the inward sinus where there is an inflammation. And very important is that we should not miss sphenoid sinusitis. Sphenoid sinusitis is most dangerous sinusitis because the relation of the sphenoid sinus is optic nerve. So whenever sphenoid sinusitis is not treated properly, it can result in blindness. Patient end up with blindness. Therefore, sphenoid sinusitis should not be missed there. So this is another form of sinusitis. So these are considered as a differential diagnosis for the migraine headache. So this is very important to differentiate it from migraine headache from other headaches. Yes, next slide. So coming to the treatment aspect of the Ardhavabedhaka. So always Nasa we consider as Nasa hi Shirosodwaram. Tena Tatvapya Hantitan. So Nasya Karma is considered as the first line of management in Shiroroga. So here also Ardhavabedhaka, Nasya Karma is considered as the one of the main mode of treatment in Ardhavabedhaka. So you can take we have done Nasya Karma with Anutaila only, Kshira Balataila, Balataila, because inward dosha is here, it is Vata dosha is the main dosha according to all the three, Charaka, Sushruta and Vagbhata. And in Vata Vyadhi, they have mentioned that Balatailam Sarvataiva Upayajyam. In any Vata Vyadhi, Balataila should be selected as a first line of first taila, as a oil of preference there. Balatailam Sarvataiva Upayajyam. For Pana, Nasya, Abhyanga and everything, you can take Balataila. So here also you can select Balatailam or Kshira Balataila for the Nasya Karma also. And coming to the clinical practice in the treatment of Ardhavabedhaka, 3M is important, triple M for migraine treatment. Triple M treatment, that is very important for migraine. So that is, one is medication. 1M stands for medication. Second M stands for meditation. Medication is the first M. Meditation is the second M. And mental relaxation therapy, that is the third M. So triple M formula for the migraine treatment. So one is medication, meditation, and mental relaxation therapies like Dara. Shirodhara treatment, these are causes the relaxation therapies. So these have a great impact on the treatment of the migraine. So first coming to the therapies, we can select Nasya already we have seen. Second one is the Dara. Shirodhara is the another one. Relaxation therapy we can do and this is going to have very good effect on the effective treatment in case of Ardhavabedhaka. We can take the different, again we can take the for Dara, Balataila can be taken, Kshira Balataila can be taken, or Dhanvantara Taila you can select for the Shirodhara purpose. And it is having a very good result. Usually, this Dara will very effective. Those patients which are having aura symptoms, those patients presenting with the aura symptoms, you can go for the Shirodhara procedure. Shirodhara procedure, it will have a great impact on in the final outcome of the treatment. And another one important thing is, we have seen in the cause of the migraine or triggers of the migraine, stress, tension, and anxiety is the triggers for the migraine. And to relieve these three is very important in the migraine management. And stress is again going to increase the migraine. Therefore, this should be kept in mind while treatment. Therefore, you can suggest the meditation, dhyana for the migraine patient. Very important meditation for the migraine patient. So which type of meditation we can suggest for the patient? So meditation contains mainly two types of meditation is there. One is concentration oriented. Another one is the mindfulness. It is called as mindfulness meditation. How to do the mindfulness meditation? That is important for the migraine management. Mindfulness meditation is nothing but the meditation where the patient should concentrate on a particular thing. For example, ask the patient to sit comfortably and then concentrate on his breathing. That is inspiration and expiration. Patient should concentrate on inspiration and expiration. This is one of the method. Second method, patient can chant the Omkara. Repeatedly, patient can say Om and concentrating only to that Omkara. So that is another type of meditation you can suggest for the patient. So this is very effective in the management of migraine. And this is not a cure for migraine, but this is going to this is very good for to handle the stress, anxiety, and tension of the migraine patient, so that you can extend the period of the migraine headache. So if the patient repeatedly getting the migraine, so this will going to have a good result on the periods of the migraine. That is, you can postpone the periods. That if every 15 days, if the patient may, you can extend it to 1 month like that. So, and severity of pain will comes down if you suggest the meditation for the patient. It is a effective pain management, and American Migraine Association has approved this meditation is helpful in migraine patient. And two types of benefits from meditation. That is, one benefit is you can reduce the severity of pain in migraine. Reduce the severity of pain in the migraine by just meditation. And another one is you can reduce the migraine attacks. Migraine attacks can be reduced, and you can prevent the migraine attacks. That is very important for benefit of meditation. So mindfulness meditation should be practiced for migraine management. So coming to our classical explanation, so Nasya Karma is considered as the first line of management. Shirodhara is another option, and all Mashtishka procedures, that is Shirobasti, Shirolepa, and you can also suggest the patient about the Shirobasti is very beneficial in case of migraine. These procedures can be prescribed for the patient. These Panchakarma these procedures are very important for in the migraine management. And coming to the medication, some of the internal medications, you can suggest the Shirashviladi Vajrasa. And depending upon the inward dosha, you can suggest patient is having giddiness, you can go for Kamadukha Rasa, Sutta Shekhar Rasa. And if the patient is having nausea and vomiting, again, Kamadukha Rasa and Sutta Shekhar Rasa is beneficial. And very important, if the patient is having Pitta symptoms, again, you can suggest Shanka Basma and Godanti Basma. Shanka Basma 200 mg and Godanti Basma 400 mg. Some of the pharmacies you can get these Basmas, Dudh Papeshwar is there, Naranarayan pharmacy is there. These pharmacies you can get these individual basmas you can get. Godanti basma, Shanka basma. I am not naming some exactly what the pharmacy, but you can get your own medicine there. But Shanka basma in combination with Godanti basma is very beneficial to reduce the severity of pain, and it will reduce the aura symptoms also. Shanka basma with Godanti basma. And very important thing is Jatamamsi is having a very good result in Ardhavabedhaka. In clinical practice, we have seen that Jatamamsi is going to produce the very good outcome in reducing the symptoms. And Jatamamsi, the quantity should be 1/4 teaspoon, 1/4 of the teaspoon or half teaspoon you can prescribe in the morning and in the evening. Twice you can prescribe Jatamamsi Churna. And this Medhya Rasayana is very helpful in migraine patients. That is Brahmi, Manduka Parani, and this set of group of medicines is helpful, beneficial for the migraine patients. And Brahmi is helpful for the patient of migraine with the aura patients. These Medhya Rasayanas is going to help rather than the migraine without aura. Migraine with the aura patients responds to the Medhya Rasayanas, which is you can prescribe to the patient. So depending upon the symptoms they are presenting, because all the patients have not having same symptoms in case of Ardhavabedhaka. So depending upon the Sushrutas concept is the Brahma is there. So then it is exactly the Pitta is there, Pitta symptom there. So according to that, we have to treat the patient depending upon the inward dosha. And another one is Patyadikada. Patya Aksha Datradi Kashaya is helpful for the migraine patient. So these are some of the medications which can be given for the migraine patients. So 3 triple M: medication, meditation, and some of the relaxation, mental relaxation therapies like Shirodhara or Shirobasti is helpful for the migraine patient. And very important, what about Shodhana? Which type of Shodhana we can select? And I have seen practically Virechana is very helpful in case of migraine patient not responding to the any above treatments. Then you can ask the patient, or you can go for the Virechana procedure. Or some of the, if the patient is agrees to the, if the patient is, then Virechana is the first line of management. Then you can first go for a Shodhana. Then you can go for the Shamana type of treatment. But very important is only patient coming with a migraine headache, sometimes they are not going to agree for the Virechana in the initial treatment. Therefore, first you can try this above line of treatment, that is Nasya, Shirobasti, and internal medication, meditation you can try. When they are not responding to the above treatment, then you can suggest the patient for the Virechana. In Charaka, they have mentioned that Virechana is a line of, in the treatment principles, they have mentioned Virechana in Charaka Siddhisthana, 9th chapter. He has mentioned in the treatment of migraine, Ardhavabedhaka, he has mentioned Virechana as a one of the option, Shodhana therapy. That is Virechana you can select. So, but the very important thing is when the patient he is not willing for the Virechana in the initial presentation. So then you can go for the other treatment modalities. So this is another one. And Charaka has also mentioned Basti, Anuvasana Basti, because Charaka has clearly told that Vata is the main dosha involved in Ardhavabedhaka. Therefore, you should go for the all Vata Hara line management. You can also select the Basti, Anuvasana Basti and Astapana Basti. But I have not tried in my practice Anuvasana Basti or Astapana Basti. But Virechana, I have seen very wonderful result and patient got complete relief from the migraine headache in who have undergone Virechana line of management. Then we have given Nasya and other treatment modalities. So this is about some of the treatment principles and internal medications which is helpful for the migraine patient. So this is about the management of Ardhavabedhaka, migraine, and differential diagnosis of migraine headache. Thank you.
Thank you, sir. Shall we go ahead to question and answer session, sir?
Okay, okay.
Okay, sir.
Delegates can post their questions in the chat box. There is a question in the chat box, sir.
Okay, okay.
How many drops per day for Nasya can be given and timing?
So Ghritam, I have selected Murchita Ghritam, simple Murchita Ghritam for the Virechana procedure.
Thank you, sir.
And you can also select Varunadi Ghritam, which is Vatahara and Vatakafahara.
Thank you, sir. There is another question. How many drops of Nasya per day and timing of Nasya?
So practically in my practice, I have selected 10 drops per day, and I have selected Balatailam, Shira Balatailam, and Anutailam in migraine patients. And I have seen that Anutaila is better, giving better results.
Thank you, sir.
And some of the practice rural practice, I have seen Drona Pushpi Swarasa is used for Nasya, but I have not tried. Personally, I have not tried, but Drona Pushpi, some I have seen that Drona Pushpi Swarasa is also used in migraine. But personally, I have not used Drona Pushpi Swarasa in migraine. 10 drops each nostril, yes, yes.
Thank you, sir. Which is preferable for migraine? Shadbindu Taila or Anutaila?
So you can select Shadbindu Taila or Anutaila, but I have seen in my practice that Anutaila is giving better results.
Thank you, sir. 10 drops.
So I have done Nasya Karma for 7 days. In every patient, Nasya Karma is done for 7 days. 7 days course is given.
Thank you, sir. There's another question. Many patients with cervical spondylitis show Brahma and headache. Is it okay to relate with migraine?
Yes, that I have missed during the differential diagnosis. One of the disease which presents similar to migraine is the cervical spondylitis. But we have to differentiate cervical spondylitis from migraine. That in cervical spondylitis, neck pain is also there. And cervical spondylitis patient can also present with giddiness. And cervical spondylitis patient can also present with a headache. But very important, cervical spondylitis will have a neck pain there. So migraine patient will not present with the pain in the neck.
Thank you, sir. Moving on to next question. Which time is best for Nasya?
So we are doing Nasya Karma in the morning time itself, but in our classics they have mentioned depending upon the dosha we have to select the time. So if depending upon the dosha involvement, you can select the time. But main dosha involved in migraine is vata dosha, then you can select the time depending upon the involved dosha. So evening time is preferred. But sometimes practically patients are not ready to in the evening time, then we have done in the morning time itself. Then also it is beneficial. But if you go for the doshas, then it is, if vata dosha is predominant, it should be done in the evening time.
Thank you, sir. Moving on to next question. Line of treatment in case of chronic sinusitis patient with headache.
So chronic sinusitis patient, again, Nasya Karma is the first line of management. You can select the Gudardhraka Nasyam, or you can select the Anutaila again. And chronic sinusitis patient, you can go for the internally Shirashula Vajrasa, and you can go for the step capsule. That is not a classical preparation, but step capsule of Vasu is giving a very good result in case of a chronic sinusitis patient internally. And so, of course, Nasya Karma is selected as the first line of management. And for chronic sinusitis, in my practical experience, I have seen Shirashula Vajrasa, Mrutyunjaya Rasa, and step capsule, along with Patyadikada. If given, it will be giving you a very good result.
Thank you, sir. Moving on to next question. Nasya should be given before food or after food?
So usually we prefer before food Nasya Karma we do here. Yes, it is step capsule of Vasu for sinusitis, not for migraine. For chronic sinusitis, you can try step capsule of Vasu, and you can also try Shirashula Vajrasa with the Mrutyunjaya Rasa. And Patyadikada can be given both in sinusitis and migraine.
Thank you, sir. Moving on to next question. Migraine during pregnancy, its management, sir.
So migraine during pregnancy time, I think it is, you can go for the meditation, and what I say, you can select the, some of the drugs you can give. You can go give the Patyadi Kashaya, you can give, I think, but in milder dosage. But Nasya absolutely contraindicated during pregnancy. Any procedure, Panchakarma procedure is absolutely contraindicated in pregnancy. You should not do the Nasya Karma. You should not do the other Shirobastya or Shirodhara. It is, I think, absolutely contraindicated. We have not done any treatment procedures for the pregnancy. But internal medication in very mild dosage you can give. And I think better to manage with a meditation or other procedures. Not a Panchakarma procedure.
Thank you, sir. Delegates, if you have any questions, you can post it in the chat box. Thank you very much, sir, for answering all the questions.
Okay, thank you.
Thank you, sir. Now I request Dr. Ajay Paul, Associate Professor, Department of Kai Chikitsa, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Thank you. Good evening, everyone. It is my audible.
Yes, sir. Audible, sir.
Good evening, everyone. It is my privilege and great joy for me to extend a vote of thanks for today's session. I would like to express my sincere gratitude to Dr. Satish Shanker sir for sharing your valuable experience on the Ardhavabedhaka. I am sure that the participants are immensely benefited by being here. Thank you so much, sir. Lastly, extend my gratitude to all of our delegates who have participated. Thank you once again. Thank you all.
Thank you, sir. It is
Okay.
not even the beginning of the end, but it is perhaps the end of the beginning. Our next session will be on 8 June by Dr. Harshida Sandeep Dahilekar on the topic Clinical Concept of Visham Jwara Pathogenesis in Bale Samhita with special reference to CRS. To know more about our updates, please do stay connected with our social platform. That's all for today's most interesting session with a lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.